All right, you guys, now we're the right side. Welcome to Get Real with Rick Dancer. Excited to show you this new technology here in Eugene, Springfield. Just started since August. And this is a new way to treat acute depression. And there are some very strong rules that have to go along with you in order to be a patient and a client. But it's also something that is seeing some really good results for people. FDA approved, all kinds of folks coming interested in this, and a local doctor brought this to Eugene and his partners, and it's something new that is we're hoping can really help, because we're going to hear some statistics about depression and how many people it's a huge cause of suicide in our country, as everybody knows. And we're going to talk a little bit more about that in just a second. So here we are. There you go. Hi, Matt. How are you? Welcome. Come on in, Roger. So you guys, I'm going to introduce you. Come over this direction, my man. Right. This is Dr. Roger Hall, a radiologist since 1967.
Well, I've been doing radio since 67.
Since 67, a long time. Right. And has been doing MRI work. And you saw this. How did you find this technology?
Well, I had a friend that had a severe, unrelenting depression. I started reading about depression treatments. I came across this type of transcranial magnetic stimulation treatment. I thought it should be available in Lane County. So that's how it came.
So let's show people the diagram of. Can we show the?
Sure.
You guys, we're going to show you what a brain looks like here. Sure. So here's a diagram. Let me show you real fast here, guys.
Yeah.
So this is a non-depressed brain. So what we would hope would be a normal brain.
That's correct.
And you guys see all the yellow in here?
That's right. The yellow represents oxygen uptake in a normal functioning cortex.
And this is a brain that's depressed, where depression is, because up in here is where everything starts, and it's not.
Well, that's right. This shows cortical hypoactivity of the brain in a depressed brain, or a hypofunctioning cortex.
So show people with your hands, kind of. So you guys, this is what happens in a brain that is depressed. They're thinking. You were showing me how the circuitry doesn't connect.
Well, we treat with transcranial magnetic stimulation a small portion of the cortex in the left dorsolateral prefrontal cortex, which is right here.
So
this hypoactive part of the cortex.
Hold on, guys.
Okay.
So right in here is where they treat.
That's correct.
They use this machine right here.
That's correct.
And this is a magnetic field, right?
This is a coil that creates a magnetic field. That's correct. And this is positioned over the lateral aspect of the prefrontal lobe.
So this goes right over the front of your head.
Right. That's right.
And then it basically shoots
a magnetic pulse.
That
creates a small magnetic electrical field in this part of the brain.
And so the whole idea, Dr. Hall, is to get that circuitry reignited again.
That's correct. Exactly right. Neurotransmitters are depressed in this area, do not allow normal connections of the cortex, and that area of the brain then connects to deeper centers in the brain, which have to do with modulation of mood, and in these patients have to do with modulation.
So you guys, let me show you another diagram here. Check this out. So see right here, this is the machine here. This magnetic field is here.
That we treat here. This circuitry here then connects to deeper areas of the brain that have to do with mood, particularly the amygdala, the hypothalamus, the anterior cingulate gyrus, and all these circuits are reconnected. Essentially, they restart.
So basically, this is not these are the areas where you're feeling, where things are happening in your brain, and you're not. And in order to get that circuitry to connect it again, they do the magnetic field up in here. Then that goes back into here, reigniting everything and making patients actually feel better.
Absolutely. This is highly successful for a high percentage of patients. 35 to 40% of patients have a remission of depression, Another 30% or so have significant improvements in depression. This is a new approach to depression. It does not replace psychotherapy, but it offers a new approach, and it's very successful in a high percentage of patients that have not responded to normal drugs. So many patients can get off their drugs or they decrease their drug uses, and it's been highly successful. It's been researched for years, since 2009. The research centers are at Stanford, Harvard, Mayo Clinic, Johns Hopkins. So it's major research centers have been using this treatment for a decade now, and should be available in Lane County, and now it is.
So you have to, it's a pretty specialized, because the requirement is people have to be severely depressed and they have to be on certain medications. This isn't for somebody who deals with seasonal depression or someone who just has the blues.
This is not a situational affective disorder or a seasonal affective disorder.
And like you said, it does.
We talked to our medical director, Jocelyn Bonner, about the requirements for these patients.
Okay, let's bring Jocelyn in, you guys. This is kind of, Jocelyn, come on in here. So this is, so you're a psychiatrist or psychologist? Psychiatrist, okay, because I have trouble with that one. So Jocelyn, welcome. Thanks for being here. So what does a patient need to be able to qualify for this kind of treatment?
So we're looking for a diagnosis of major depressive disorder, severe, without psychotic features, meaning they have to be in touch with reality. They have to have failed several medications and also failed counseling. So that's what the ideal candidate would meet those criteria.
So what is it about this therapy that brings you in here to be part of this whole thing?
Well, it does offer an alternative to medications. We see a lot of people that don't respond to medicines. Many trials, many years of depression. So this offers a viable alternative to people that have not responded to traditional treatments, such as medications and counseling.
When you're sitting down and talking with someone about this, what are you looking for?
Well, I'm looking for signs and symptoms of depression, mostly by self-report and by rating scale. So the typical signs of depression or symptoms of depression are low mood, frequent crying, low self-esteem, guilt, lack of pleasure in usual activities, interference with work, relationships. Some people do have suicidal thoughts to go along with depression. So those are kind of the basic symptoms that we're looking for. It can also affect sleep and appetite. Again, just people become socially withdrawn.
Somebody has a question on here.
All right.
You mentioned this is for people who are non-responsive to drugs. If a person was one who refused to take antidepressant drugs, would they not be accepted as a candidate?
Well, if they meet all the other criteria, we could possibly consider someone. However, the insurance is not going to pay if you don't have that history of lack of response to medication.
Okay, so if you have a history of a lack of response, insurance does pay for this?
Yes.
Okay.
All insurance policies that we've dealt with so far have all paid. We have to go through a prior authorization process. That way, they know what criteria and why we're submitting the person for approval to the insurance plan.
I know you guys haven't treated a lot of people because you've been here since August. Here, it's been treated in other places, but
Yes.
What do you see as, I was here one day and a gentleman was there talking and he said he was happy for the first time in years. He felt a little bit happy.
Yeah, so far the results have been good, promising. Of course, we want to see how they do after treatment, but we haven't had anybody relapse or get worse. I would say 99% of our people so far have gotten better. Most people are still in the middle of their treatment, so we don't have a big database yet. It looks promising.
How long is treatment usually?
6 weeks.
6 weeks? And how often do you have to do this for most people, according to the research?
So Monday through Friday, about a half hour. Active treatment is probably between 18 and 19 minutes. And the research shows us that we need to do 6 weeks. It didn't separate from placebo until after 4 weeks. So we like to do 6 weeks, and then we like to have a few tapering sessions after that 6-week period.
And do you have to do this again every year or something like that, or is that?
Well, it's shown durability out to a year. Of course, it's been done since 2008, so there's a body of data. But as far as recent research, we know it's durable for a year. If someone does relapse, we can reapply the treatment and we can get a response a second time.
So is there any side effects from it at all?
Side effects are a bit of facial discomfort right where we put the coil. That usually goes away in the first few days. There's a slight risk of seizure, 0.003%. So we can't take anybody that has an active seizure disorder. That's really about all the side effects. It's pretty remarkable. I mean, that's why I think it's a viable alternative to medications, which of course have multiple side effects.
Right, right. All right, thank you.
Thank you.
Okay, Roger, come here, bud. So, how do people get a hold of you to come in and find out more about this if they have a family member or someone they think can benefit from this?
Well, first thing I would do, of course, you could call our number.
Right, and the number's on the
And the
screen.
number's on the
It's on the
screen.
top of the page up here, guys.
If you're under treatment, I would ask your treating physician about the technology.
Okay.
I would go on Google and Google Stanford TMS or Harvard TMS or Mayo Clinic TMS. They all have websites, and we have a website.
Okay.
It's the Emerald TMS of Oregon, and you could Google our TMS. And then, of course, you could call us at any time and talk to us about the therapy. And you can come in and see what we're doing here.
Right. In
And
fact-
we welcome anyone just to drop by and talk to our personnel.
So next week, we're actually going to come in and talk with a patient and
Great.
see how this kind of works to give you guys a better look at what it is. Because I saw it, Roger showed me a few weeks ago, and it's not scary. Of course, we've been through a lot of things in our lives, haven't we? But it really isn't scary, but it's something you really should check out for yourself. And then if you have questions, just call in and ask them about that.
Well, that's right. And the beauty of this is that it's an outpatient therapy with no preparation, no medications involved, no anesthesia involved. You come in for your routine 30-minute session, you go back to work or whatever you're doing, and you have no cognitive deficit, you have virtually no side effects. So it is a wonderful therapy, and it's effective for a lot of people.
So again, you guys, this is new to Eugene Springfield, only since August.
That's correct.
And it is you'd have to qualify, so you need to call in and find out more about that and what that means for you personally.
That's correct.
We will be having more next week on Monday. We're going to be back here talking more about this. And also we'll have some other video stuff that you guys can find out, because the depression, especially this time of year, is a huge problem. Now, again, this isn't for seasonal depression. This is for people who are acutely depressed, but there's a process you go through to get approved for the process.
That's correct. And we should know that 40,000 suicides yearly in this country.
So,
And at least 90% of those have some component of depression. So it's not simply for suicidal patients, but that is a large component, a large number of depressed patients. And not every depressed patient is suicidal, of course.
right.
But it does affect people's lives.
And the quality of their lives is
Absolutely,
right.
in a serious way.
Well, thank you for bringing it here.
Well, thanks for being here.
Oh, yeah. Okay, you guys, so take this, share it on a page. If you know people that might be suffering or struggling with this, please let them know about this, and we'll be back again next week. All right, share it. See you guys later.
Okay, thanks.